ሳይሰራልኝ በፊት በጣም ነበር የሚያመኝ I think 12 አመት ነው 13 አመት ቤተሰብ ከኔ በበለጠ ቤተሰቦቼ ናቸው የተጎዱት በጣም ተጨነቁ በቃ እቺ ልጅ መሞቷ ነው ተብያለሁ እጣ ደረሰኝ እንዳጋጣሚ እድለኛ ነበርኩ እንግዲህ ስራ እየፈለኩኝ ነው ያለሁት አሁን እግዚአብሔር ይመስገን እኔ ምንም ማመስገን ያለብኝ እንጃ በቃል አጣርቼ እንትን አይደለም
يونكوتن السما هم نقروتن سوا لبيك التوان لكن دشاما هم يونكوتن السما هم نقروتن سوا لبيك التوان لكن دشاما قلب مندرو ودي لبيانتن فلقا قلتن دشا مندتوا فانتن كراغن يرغا
My name is Vip Kshetri. I'm a senior cardiac surgeon at Minneapolis Heart Institute in Minnesota. You know, it's a common belief that cardiac disease is more prevalent in the developed part of the world, in Western countries. But the truth of the matter is the cardiovascular disease is affecting low-income countries. So this has been calling for me on a personal level for over 20 years, trying to make a difference in areas of the globe where there is a deficiency in cardiac care. That's my specialty, and that's one of my ways to give back to the society and global community at large.
The essence of the model is to look at the full continuum of care and to provide pediatric cardiac surgery care for children who must have open heart surgery, but at the same time also prevent heart disease in children when you can by preventing rheumatic heart disease.
ስሜ ቤዛዊት በለጠ ነው እና እድሜ ደግሞ 14 ነው
ስሜ ትግስት ጌታቸው ይባላል እድሜ 23 ሲሆን ተማሪ ነኝ
My name is ቤዛ ያሬድ ታናሽ ወንድም አለኝ ከሱ ጋር መጫወት የምፈልገው ድብብቆሽ
እኔ ከተሰራልኝ በኋላ ኳስ መጫወትና ሳይክል
እግዚአብሔር ከፈቀደና ከቻልኩ እንደገና ከ10ኛ ክፍልን ተፈትኜ ጥሩ ውጤት ማምጣት ፈልጋለሁ
As you know, Ethiopia is one of the most populous countries in sub-Saharan Africa, and the average age of Ethiopians is very low. I found out that the valvular heart disease and the congenital heart disease is rampant here. In addition to that, I found out that Ethiopia really doesn't have a trained cardiac team or an institution where they can help their fellow citizens. So I decided on an endeavor to train a team of Ethiopian professionals so they can return back and be self-sufficient. To that effect, we've had over 10 professionals trained. Currently we have a full cardiac team, and the hope is when they finish their training in the next 18 months to 2 years, they'll be able to return and run this institution, which is a national treasure as far as cardiac care is concerned. For this mission, we had requested another team from India to come and join us. Some of the senior members of the team I've had previous occasions to work together. Dr. Sandeep Atwar, who I've known for many years, I've had an opportunity to mentor him during my previous missions. He's obviously chief of surgery in his own right, and I'm very proud to see him in that role.
I'm Dr. Sandeep Atwar, and I'm a heart surgeon by my profession. I would be operating on kids for close to 2 decades now. So Dr. Shetri, he got me to do my first valve replacement. So we go back 20 years, and I have always derived inspiration from his style of working, his attention to detail, and his discipline. When he called me up a couple of months ago and said, Sandeep, I have this mission that is very dear to my heart, and I would like you to kind of consider joining it with your team. And I don't think that required a second thought. I just jumped at the idea, and here we are. And I think it has been the most fulfilling week of my life, if I may say so. It has been a great honor and a privilege for me to be invited and to be associated with Dr. Shetri and the Minneapolis Heart Foundation.
He and his team has been working shoulder to shoulder with our team and really has contributed in an extremely positive way to make this mission even more successful. Missions can come and go in any institution in any part of the world. But if that institution does not have trained professionals to run that hospital on a continuous basis, 12 months a year, and be self-sufficient, I think no mission can be complete. You have to train local teams to come up to international standards, to improve cardiac care in their own country. Last year, during one of the missions here, we were introduced to 6 young Ethiopian professionals, and 2 of them were surgeons in training.
My name is Fakada. I am from Ethiopia, and I was born and grown up here in the capital, Addis Ababa. And I am a medical doctor. I am a general surgeon, and now I am studying cardiac surgery in India.
They had a great desire to help this institution by having an opportunity to train as cardiac surgeon. I personally interviewed all 6 of these physicians, and what struck to me as a common theme was their desire to learn, their desire to improve, and their commitment to Ethiopia and their commitment to this institution.
The work that Dr. Kashetri and the Indian physicians, and seeing them all come in here and perform the surgeries is wonderful, but you've got to have something that is going to be sustainable and is going to be able to be carried on by the Ethiopian community themselves.
Our mission goal, our overall goal has always been to not just do the work, but to teach those nurses how to become independent ICU, open heart surgery recovery nurses here themselves.
So with that mission in mind, in addition to touching individual lives, we take great pride in making an effort to provide teaching to all healthcare professionals in the institutions we do missions in.
We are hoping that by developing indigenous expertise in cardiovascular care, particularly pediatric cardiac surgery, we will be able to have continuous operation of this hospital. It has to sustain itself.
I think this program is in its initiation, but it is obviously going to be the start of a long heritage for this center. The local team members are very motivated, and they're very fired up. They would love to do this going forward.
Again, for the local doctors, we are being a mentor to them, an educator to them, and trying to understand what they need in the future. What will it take for them to be successful? And can we be part of that success in whichever way it's possible?
He's helping us really, just not by operating some 10 or 15 patients, but he's really helping this country by empowering the people.
At the end of the day, you take a young individual and make him a healer.
strep throat. Like many mothers, I have rushed my children into the clinic when they've had a sore throat. They've gotten a quick swab, a prescription for penicillin, and I never think twice about it. They're fine. But if by fate we had been in a different country, Ethiopia, for example, it's very likely that she would have ended up with rheumatic heart disease. And I look at what we're doing here in Ethiopia, and I think of every mother with their daughters, and they deserve treatment. They deserve to be well. They deserve that antibiotic if they need it. They deserve that surgery if they need it. And by being here in Ethiopia, I have seen the people. They're as deserving as my own child.
We want to make sure that we provide training and teaching and encouragement to Ethiopian physicians so they can be self-sufficient. However, this is not enough. You need to go back to the root cause of why such a high incidence of these cardiovascular diseases are prevalent. So the prevention is a part and parcel of this process. Prevention in any disease process is an integral part of improving care. We can do heart surgery, we can do cardiology procedures, but the root cause of a disease can only be eradicated if you prevent the disease from the first process. We decided to look at this in a more scientific way and supported a study just to see what is the true incidence of cardiovascular disease in their population. In this study is run by Ethiopian cardiologists. The preliminary results show that 50% of patients suffer from valvular heart disease and congenital heart disease. This data proves that the healthcare resources of this nation should address rheumatic valvular heart disease as well. It is extremely prevalent. It affects young lives, and it affects shortening their lifespan at a very young age.
We're here now at a health clinic 2 hours outside of Addis to understand what we can do to prevent rheumatic heart disease in children. Thousands of children every year get rheumatic heart disease, and many will end up having to go to a tertiary care facility and getting open heart surgery. That's not necessary. We can stop it through inexpensive antibiotics at the health center level, and we're here to understand how we can help to do that. Most of these health clinics are not really set up to do any kind of diagnosis with even a field level echocardiogram and to necessarily be able to identify these non-communicable diseases.
In all the missions which I have carried out in Ethiopia, it's not uncommon for me to see a 10, 12 or 15-year-old patients with 3 heart valves severely damaged, with heart failure at that young age, their lifespan shortened acutely. So we are hoping to be an advocacy for rheumatic valvular heart disease. Currently, we are making an effort to work with the Ministry of Health and other health organizations to have a non-communicable disease process to include rheumatic valvular heart disease prevention program as a part and parcel of healthcare in sub-Saharan Africa. I have a very compassionate team who wants to make a difference in the lives of people around the globe. We have provided cardiac surgical care to individuals who perhaps will have had no chance.
Pediatric heart surgery normally does have many surprises. Almost every second or third day when you're operating, you would find a defect that was unnoticed or undetected because most of these kids have high pressures in many of the chambers.
When I see the kids, I see hope in their eyes. I see kids that want to see the future. Even when the children are scared coming to the operating room, they still have a big smile because they know they're going to get the help they need.
ሳድግ መሆን የምፈልገው ዶክተር ነው። በኢትዮጵያ ውስጥ የልብ በሽተኞች ስለሚቸገሩ በነፃ መስራት እፈልጋለሁ።
Earlier today we had this child 9 years of age. She had a serious heart defect and she was diagnosed to have a hole in the heart. We call it an ASD. A simple repair should sort the problem out. We did not realize the ramifications till we went in and opened her heart to only find that the mitral valve was completely destroyed. It is eaten up by an infection and we were completely oblivious of that before surgery.
They're trusting us wholeheartedly. They expect us to do our best, and we do our best to help them. I think medicine is an art and a science. I think the science is part of what you learn in school, but it's an art of how you treat patients.
We happen to be heart surgeons, we happen to be cardiac surgery team, so this is the best what we can do.
I think it's a great opportunity for me to help others that I can help, and I think it's my obligation being in medicine. I'm there to help.
She's done better than we expected. So it all turned out to be a good day at the office.
It is so humbling for all of us to see what we have back home and how little it takes to make a difference.
The first time I, in my travels, encountered a child who had been suffering for a number of years with rheumatic heart disease, and I realized how preventable that was. And I was with a doctor who was treating her, and we were hoping that she would survive long enough to be able to get surgery. And the daughter was the same age as my daughter, and that had such an impact because I thought, this could be my daughter right here, and it could be anyone's daughter. I've been able to see firsthand what even relatively minimal resources, what the impact of those can have in this setting.
It is morally important for affluent nations, affluent individuals, if they can make a little difference by donating their time, their effort, their support, or their dollars to make a difference in other part of the world.
So it gives my life meaning to do this kind of work, and that's why I try to get other people involved so that they will have the same joy that I feel doing this. They will have it as well.
The missions which we have undertaken is really to make a difference in lives of young people, in trying to extend their life. And I think that is morally responsible and morally important for all of us who are blessed with more than other parts of the world.
You must be the change that you want to see in the world around you. I see a sick child and it tells me that something needs to be done. So you know that you can do something about it. And there's something you can do and change this child's life for better. I think this is something that crosses every pediatric heart surgeon's mind, because at some phase in your life, you realize that when you see a difficult problem and you go about fixing it, and you see that kid's heart jump back when you restart it, and then a couple of days you see the kid walk home, you begin to realize the power that is invested in your hand. You need to take that forward. You need to train more people. You need to inspire people to do this work. And I think that's what drives me.
You see what a huge difference is made by this work, not just for the patient and not just for the family, but you can imagine a whole community being lifted up when they're given this opportunity to really rise again and come to new life after the surgeries.
Obviously, we cannot treat everybody, but we do our best to treat as many as we can. This has been a personal calling for me since childhood. Give life to others, care for others, care for your family. More important, care for strangers. To the world, you may be one person. To the one person, you may be the world.
The happiness of one person is the happiness of one world.